Let's learn about cardiac cycle and Wiggers diagram. Wiggers diagram has three pressure curves: aortic, left ventricular pressure, and left atrial pressure, corresponding to the jugular venous pressure curve. One ventricular volume curve, ECG, and heart sounds. Let's start with the phases of cardiac cycle. They are isovolumetric contraction and ventricular systole proper, rapid ejection and slow ejection, which constitute ventricular systole. Then we have ventricular diastole that constitutes of protodiastole, isovolumetric relaxation, diastole proper, rapid filling phase, slow filling or diastasis, and lastly, atrial systole. We start from atrial systole in Wiggers diagram. Just before atrial systole occurs the P wave of ECG marking atrial depolarization. During atrial systole, atrial pressure rises, giving A wave on JVP. The ventricular pressure also rises slightly, and ventricular volume increases, and blood flows from atria to ventricle. S4 heart sound may be produced during this phase if ventricles are stiff and not relaxing properly. It is also called as atrial gallop rhythm. QRS complex marks the start of ventricular depolarization, and ventricular systole occurs when we reach the peak of R wave. The mitral valve closes after atrial systole, producing the first heart sound, S1. Isovolumetric contraction occurs next, where the ventricular pressure rises, volume is constant, aortic pressure is also more or less constant. The atrial pressure also rises slightly due to bulging of mitral valve into the atrium, producing C wave on JVP. The aortic valve opens when aortic pressure exceeds ventricular pressure. It produces ejection click, which is heard in cases of aortic stenosis. The opening of aortic valve marks the start of ventricular systole proper, which consists of rapid ejection and slow ejection phase. During this phase, ventricular pressure continues to rise, more than aortic pressure, which is also rising, and ventricular volume decreases. The atrial pressure initially decreases, marking the X descent on JVP, and then increases slowly as the atria fill with blood from venae cavae. T wave appears on ECG, marking ventricular repolarization and beginning of ventricular relaxation, and the aortic valve closes. Closure of the valve produces second heart sound, S2, and dicrotic notch on the aortic pressure curve, due to brief backflow of blood from the valve. During this phase, as the atrial filling has reached maximum, it produces V wave on JVP. This marks the first phase of diastole, isovolumetric relaxation, at the end of which mitral valve opens. Mitral valve opening can be heard as opening snap in cases of mitral stenosis. Mitral valve opening also results in reduced atrial pressure, seen as Y descent on JVP. Ventricular diastole proper begins where ventricular, atrial, and aortic pressure decreases, while ventricular volume increases. It consists of rapid filling phase, reduced filling or diastasis, and atrial systole, marking the beginning of next cycle. During the rapid filling phase, if very large volume of blood gushes into ventricle, S3 heart sound may be heard, also called as ventricular gallop rhythm.